Are we good?
Yes.
Hi again. So we're going to talk to you about today what makes a healthier mouth. So please meet our beautiful team. We are a CDA student from Vancouver Community College. We have Anna. We have Ashley.
Hi, everyone.
And myself, Fatimah. And we have Janine as well.
Hi, everyone. Nice to see you.
So now I have a short question for you guys. Which picture is the healthier mouth? I see a lot of in the comments saying number one. That's correct. Number one is a healthier mouth because as we can see, the gum is pink and firm, which is beautiful. That's what we want. On the other hand, the gum is not looking very great as it red and flame, and we can see there is some type of infection going on there. We can move to our next question. The next question is saying, what are the factors that contribute to a healthier mouth? If anyone can unmute and tell us about that or write in the comments. Going to the dentist, that's correct. Yes, I like that. What else we do on our daily basis to maintain that healthier smile? Brushing our teeth, that's correct. Yes, so actually brushing and flossing plays a really big factor to maintain our oral health. But also, did we know that nutrition plays a big factor? Yes, eating healthy food plays a big factor to maintain that oral health and keeping that smile healthy and strong. So we have 4 topics we're gonna explain to you guys about more. The first topic is the regular visit to a CDA at the dental office. Second topic is gonna be the common oral health diseases. And third is the nutrition snacks for healthier teeth. Also, we have 4, the importance of effective brushing and flossing and how to do it effectively. So now I'm gonna pass it to my friend Ashley to explain to us more about the regular visit to the CDA at the dental office. Here you go, Ashley.
Hi, everyone. So I will be explaining and talking to you guys about regular visits to the CDA at a dental office. Okay, so what exactly is a CDA? A CDA stands for a level 2 certified dental assistant. And what makes us different from a regular dental assistant is that in order to become one, we go to school to complete a formal education. Our clinical skills are also examined, as well as taking a board exam for dental assistants, in which will make us a certified dental assistant. We are an essential member of the dental healthcare team as well. And one of our big roles is that we have a professional responsibility to help you guys maintain and promote oral health. We ensure all patients receive the most comprehensive and complete oral health care when you guys visit a dental office. So now I will be explaining to you guys what some of the roles are of a CDA. So when visiting the dental office, we prepare the patient before seeing the dentist. So an example would be when we are providing you guys sunglasses before treatment or providing you guys a dental bib as well. And we also assist the dentist during treatments and procedures. So this could be passing dental instruments to the dentist as well as mixing materials. And we also are certified to carry out some certain procedures under the direction of the dentist. So that would be polishing, cleaning your teeth. We're allowed to take x-rays as well. And also, we give effective oral hygiene instructions as well. And one of the most crucial roles of a CDA is providing patient care and comfort before, during, and after treatment as well. And we also give pre and post-op instructions. So when you're going to the dental office for a surgery, for example, or if you have an extraction to be done, We tell you guys and give you guys proper instructions how to take care of yourselves after the treatment. We open and close operatories. So when we're opening, this means that at the start of the day, we make sure that the water and the lines are flushed out and cleaned when the first patient comes in and visit the dental office, as well as setting up trays too. We also clean and sanitize and disinfect the dental rooms as well, ensuring that just like really maintaining infection control. So I want to ask you guys a question. So you guys can type it in the chat or unmute yourselves. So how often should you be visiting the dental office? You guys can take a guess. Once a year, yeah. It's a good guess. Okay, so actually, it is recommended by the Canadian Dental Association that we visit the dental office every 6 months. So that would be twice a year. And however, some patients or some people may need to visit the dental office more frequently due to having a greater risk of dental diseases, or if there's a procedure, a longer procedure that takes a longer time. And taking good of your teeth is one of the best things that you can do when maintaining good oral health, as well as good general health too, since teeth are part of our mouths that we use for chewing, tearing, and eating food. It's a really important and good idea to visit your dental office every 6 months. And now I'll be explaining to you guys why it's important to visit the dental office. So we ensure that your teeth and gums are healthy, and to check if there's any abnormalities that may otherwise go unnoticed. Having your teeth cleaned frequently has a lot of benefits, not only to your appearance, but again, your overall health. And some of these benefits are the prevention of gum infection, as well as gum disease. We also professionally clean your teeth to remove any plaque or biofilm buildup. Just really learning how to maintain good oral hygiene. So that is why it's a really good idea for you to schedule a dental checkup every 6 months. So now I will pass it on to Anna, who will be explaining to you guys what some of the common oral health diseases are.
Hello. So I have a question for you. Do you guys know what biofilm is, or have you heard of what biofilm is? Okay, so oral biofilm is also known as plaque, so that's like the more common term that you would hear. It's a colorless, soft, sticky coating made up of many microorganisms that stick to every surface in your mouth. So tooth surfaces, dental appliances, restorations of teeth, gums, tongue, and bones, so basically everything. And dental caries, gingivitis, and periodontitis are all caused by microorganisms in a person's biofilm. And now I'm going to talk more in depth about gingivitis. So gingivitis is a mild gum disease, but the easiest to control and treat. And gingivitis is essentially inflammations to the gums and occurs due to biofilm buildup on the teeth. So it is important to disturb biofilm every day, because if biofilm is not disturbed, then it remains attached to surfaces in your mouth and accumulates. So something like moving your tongue along your teeth or even using mouthwash is not enough to dislodge biofilm. It does need to be done with a toothbrush and floss. So the microorganisms in biofilm can cause inflammations to the gums, and once this process takes place, the gums will appear red and puffy, such as in the picture that we have in the middle here. And if you ever notice your gums bleeding from either brushing or flossing, then this could be an early sign of gingivitis. And luckily with gingivitis, it is reversible, so it can be restored to a healthy state with the proper brushing and flossing techniques. So now we're gonna dive into our next topic, which is periodontitis. So gingivitis can progress into periodontitis if a person does not treat it adequately. And periodontitis is a more severe condition and can lead to further complications such as tooth loss. If biofilm is left on the teeth and gums over time, it will calcify. So the minerals in your saliva will absorb into the biofilm, leading to the formation of a harder deposit, which is called calculus. So with calculus, you would have to go into a dental office and get either a dentist or a hygienist to clean it, because unfortunately, with just brushing and flossing, you cannot remove it yourself. And if the biofilm is, the roughness of calculus will irritate the gums and serve as a surface where bacteria and toxins can embed and prolong the inflammation and affect the ability for tissues to heal. So basically, over time, the inflammation process initiated by microorganisms and its toxins can break down the tissue and bone supporting the teeth in your mouth. So the damage of this disease cannot be reversed, unfortunately. So once you lose bone or tooth, you can't grow it back. And this is usually a result of very poor overall or oral health. So in the middle here, we have two pictures. They're radiographs. So the picture on the left shows good supporting bone and is aligned with the gum line. However, the picture on the right, when you look at the yellow line, you can see that it is slowly decreasing and the bone level is being lost. And lastly, we are going to talk about our last topic, dental caries. So you probably have heard of dental caries known as dental cavities. So that's the more common term that we hear nowadays. So basically, when you eat certain foods, the bacteria on your teeth breaks them down and produces acids that have the ability to seriously damage the hard tissue on your teeth. The sugars in the food that we eat are absorbed into the biofilm deposit, and these areas of decay require restorative treatment by a dentist. So that's why, how Ashley was saying earlier on in the presentation, it is important to visit your dentist twice a year just for that regular checkup so that they can detect dental caries early on and cut it out so that it does not progress. So basically, when bacteria come into contact with sugars and starches from the food and drinks that we consume, they form an acid. So this acid then attacks the tooth's enamel, causing it to lose minerals, also known as demineralization. So the repeating cycle of these acid attacks can lead to small holes in the tooth, which are called cavities. And if tooth decay is not treated, it can be quite painful and infectious and will rot the tooth away. And now we are gonna pass it on to Ashley, who's gonna talk about halitosis.
Hello again. So I will be explaining to you what halitosis is. So halitosis is a oral health problem where one of the main symptoms is actually having bad smelling breath. That is because when we don't clean our mouth, the bacteria and biofilm can accumulate on your tongue. So when you're looking at yourself in front of a mirror and you stick out your tongue, you may notice a yellowish, whitish coating on your tongue, as you can see from the picture right here. And halitosis can be prevented. And how we do that is that we clean our tongues every day by using a tongue cleaner that you can see. There's an image on the bottom left and right. That's a tongue cleaner. And the benefits of having a tongue cleaner and using it every day is that it will freshen up your breath and remove the bacteria as well and improve your sense of taste. So as you can see on the right side of the picture, this is what the tongue looks like when it's healthy and cleaned and there's no biofilm or bacteria on it. And how to use a tongue cleaner is that you just take your tongue cleaner, you place on the back of your tongue and you just pull the tongue cleaner forward, removing the biofilm and debris. And once you remove it, you can rinse your tongue cleaner under water, or you can rinse your mouth. And you can do that a couple times until essentially your tongue looks a bit cleaner and it feels a lot fresher. And just the importance of cleaning your tongue, it improves your oral health as well. Now, everyone, since we have familiarized ourselves with the common oral health diseases that Anna mentioned, Fatimah will be explaining to us one of the causes and why this happens.
Sorry, so before Fatimah starts, Ying, you have a question?
Okay.
My question is, when you're brushing your tongue, how far back on the tongue are you supposed to go?
Just,
Because you know how, like, if you go too
Yes.
far, you
yeah,
hit your little dangly thing?
yeah, I know.
You start to gag, yes.
Yeah. So how
Yes.
far are you supposed to go when you're brushing your tongue?
It's not too far that you will gag. So just like the one, like do it when you put it in your mouth where you can take it, not really to put it really at the very back one where you can gag. So just like, yeah. So just like put it like that and then slide it down.
I'd say like not too far back where you're gonna like, make yourself gag, because we don't want that. Just I guess if there's like, if you see that there's biofilm and bacteria in that area and it's a little bit farther back, then if you can reach that spot, then that's good. If you can't, then you can just like gently try pushing the tongue cleaner back and forth. Other than that, yeah, that would be my suggestion.
Thank you for asking the question. All right, Fatimah?
Yes. Hi, everyone again. Now I'll be talking about the nutrition snacks for a healthier teeth. So just mindful snacking for a healthier mouth. As we know, the food we eat gives us nutrition, but also helps us to prevent our oral health in general. So the healthy snacks we eat prevent us from infection and diseases, the ones that Anna just explained to us about. So there is two types of snacking. There is the cardiogenic and the non-cardiogenic. As we can see, the non-cardiogenic are the healthy choices, the fruits and the vegetables, and the non-cardiogenic, probably the non-healthy choices. So they're the donuts, the ice cream, the muffins, the candies. So we'll go in depth about the cardiogenic snacks. So the cardiogenics, the ones we want to prevent, we want to avoid of having them, not just for our oral health, but in our health in total, as they are bad for our health. I would say not the right choice. They are sticky and starchy, which makes them stick on our teeth for a longer period of time. For example, chocolates, candy, soda. These snacks, they makes our mouth more susceptible for cavities, the one Anna just explained to us about. So what is cavities? Is the holes in the mouth that the bacteria multiplies and make them more. And now we have to go and get a treatment for that. Where we have the good snacks, the non-cardiogenic, they are good. They prevent our mouth from having oral diseases, as they leave the mouth before they turn into and they turn and react with the bacteria in our mouth. For example, apples, carrots, pears. These prevent and stimulate saliva flow in our mouth, and they buff the amount of acid that release onto the teeth, and some of them promote a really good healthy gum for our mouth. For example, now I have an apple and I have an orange. I can eat the apple, it's good for my health in total, but the orange is more rich with vitamin C. and is better choice for me, as it helps me to maintain that healthy gum and also maintains that my immune system is boosted. For example, we go back to the carcinogenic slide. Most people will tell you that carcinogenic is the sugary food, the chocolate, the soda, all of that sugary beverages. But did we know that crackers, chips also are carcinogenic? Because they are sticking on our teeth for a longer period of time. And also, you're gonna be a surprise now, but dry fruits, they are also a carcinogenic snacks, as they are the most snacks that stick on our teeth for a longer period of time. I know. If we can go back now to the non-carcinogenic. So now we talked about the non-carcinogenic. I'm gonna explain more about the frequency of eating a carcinogenic snack. For example, there is a person who's eating a chocolate bar, but he's eating it or she's eating it throughout the day. So that makes them more susceptible for cavities, caries. While there is a person who's eating this chocolate bar in one sitting, and after that they rinse their mouth with water. They are fine. But why we're not supposed to eat the carcinogenic snacks throughout the day? I'm gonna explain now. Because the pH level in our mouth drops, and then when pH level drops, the acid level increase. And when the acid level increase, unfortunately, it stays high for a long period of time. And this makes us more susceptible for dental caries and cavities. So in order to reduce the frequency of sugar exposure in our diet, we have to limit the intake of the sugary beverages and the sugary stuff we eat. And also a tip, by rinsing your mouth with water after every time you eat a sugary or a carcinogenic snack. And also following the one method, for example, if we're gonna eat this chocolate, I would rather to eat it all at one setting instead of having it throughout the day. So now I have a question for you guys. If you can unmute yourself or just in the chat, say it. Which picture is a carcinogenic snack? Number 1 or 2?
1.
1, that's correct. So 1 is a definitely carcinogenic snack, as it is, they're having donuts, burgers, fries, and all of these sugary beverages and make the acid level in their mouth high for a long period of time. While on the other side, they're eating oranges, which is really good, as oranges are good for our gum. They give it that nice color and for our immune system as well. I have another question for you guys. So which snack are the best snacks to snack on during the day? You can unmute yourself or chat in the comment as well.
Avocados.
Avocados? Yes, avocados are definitely healthy choice. And also, if we can look at the right-hand side, the peanut butter jar, it says on it organic. So do you think that's a healthy one? Don't get tricked by that organic word in the labeling, because peanut butters, no matter what, they are sticky and they will stick on our mouth for a long period of time. So just be careful with the organic labeling. So now that I'm done with my part explaining to you and about the healthy snacks for your teeth, now my friend Janine will explain how we can remove this carcinogenic from our teeth and the importance of brushing and flossing as well.
All right, so hello once again. I'm Janine, and I'll be discussing the importance of brushing, flossing, and how to do it effectively. But before I start, so did you guys remember what a biofilm is?
Plaque.
Yes, all right. Yes. Right. So again, biofilm is what we know as plaque. It is hard to see, sticky soft deposit that is made up of microorganisms, food debris, just like what Fatimah have discussed a while ago, this carcinogenic food that sticks into our teeth, and it is made up of different kinds of bacteria. And this biofilm could accumulate everywhere in our mouth, like in the top surface of our tongue, and especially in the gum line and in between the teeth. And it's very important for us to remove this biofilm because it will continue to build up. And as what Anna have discussed a while ago, it can cause these diseases like gingivitis, periodontitis, and caries. And we don't want that to happen. So now I'm going to ask you guys, what do you think is the best way to remove this biofilm? Anyone? Floss? Yes, that's right. Ying?
Brushing.
Brushing? Yes, you guys are awesome. So 2 ways of brushing the biofilm, removing the biofilm, is brushing and flossing. However, it's not just brushing and flossing, but to do these two things properly, so it will effectively remove the biofilm. So here's a trivia for you. Did you know that on a daily basis, our mouth is home to over 100 million micro creatures who are swimming, feeding, reproducing, and depositing waste in our mouth? So this makes us want to brush our teeth, right? So there are 4 parts of effective brushing. So first is duration. How much time do you guys think we should spend in brushing our teeth?
At least 2 minutes.
2 minutes? Yes, you are right. Yes, at least 2 minutes. And if you go over 2 minutes, then you're awesome. Second is sequence. So which side of your teeth do you brush first and last? So how do you back teeth? Okay. Yes, thanks, Merlin. So having a sequence in brushing will also help us to avoid missing any teeth surfaces. One of the best way is what Merlin have said, start at the very back first, then going all the way around. So, and also you could also do an overlapping, so you're sure you won't skip any teeth. The third one is frequency. How many times do you guys think we should brush in a day? So you can just, yes.
At least 2.
Twice a day. Yes, yes. You guys are right. So at least twice a day. So it's in the morning and before going to bed. And lastly is free technique. How do you brush? What is your method? Do you do an up motion, up and down motion, or do you do a scrubbing motion?
Up and down.
Up and down, okay. So the most effective brushing technique to remove the biofilm is Bass method. Does any one of you know what Bass method is or use this kind of brushing technique at home? No? Okay, it's okay. That's why I'm here to discuss this to you. So why it is effective? Because it targets the biofilm at the gum line and in the pocket. So here it targets the biofilm here at the gum line, and here as what we can see it's targeting that biofilm underneath our gums. So here are the steps on how to perform the Bass method, and I also provided a video on how to do it so that what I'm explaining to you will make more sense. So first is to place the bristle of the brush of 2 to 3 teeth at the gum line in a 45-degree angle. So this 45-degree angulation will help us target the gum line and then help us not to scrub the gums as well to avoid recession in the future. Second is to gently and lightly vibrate the filaments by creating a very short back and forth movement for 10 counts. And then next one is when you move to the next set of teeth, raise the filaments of the brush and make sure that you have sequence and you overlap so you won't miss any teeth. So here's the video on how to do the Bass method. So here are the steps. So first is to aim the brush at a 45-degree angle. So just give your brush a little slant here and make sure that you aim the gum line because we don't want to scrub our gums because this will lead us to recession. Sorry. And next thing we do is to gently vibrate the filaments of the brush on the teeth for 10 counts. So as what we can see here in the video, it is effectively removing that biofilm at the gum line. And then when you move to the next set of teeth, make sure that you raise the bristle of the brush and you have sequence and you overlap so you won't miss any teeth. So I also included some toothbrush precisioning, and this one is on the back teeth. So this one is for the upper back teeth, outside angulation. This one is for the upper back teeth again, inside angulation. And here is the lower back teeth, outside angulation. And here is for the inside. And this toothbrush positioning is for the front teeth. So here's the upper front teeth. So as what you can see, it's the same position as what we do at the back teeth. However, when we move to the inside angulation, as what you can see in the position of the brush has changed because obviously we cannot fit the head of the brush there. So we use the tip of the brush on these front areas so that it is easy to access and you can properly clean your teeth on the inside. So here's the video on how to do the best method for the front teeth. So it's still the same method. So point the brush, aim the brush at a 45-degree angulation, and then do a gently vibrating motion. All right, so that's done. So here are some helpful tips for you. So first is, it is better to use a soft bristle brush because it is not as abrasive as the normal bristles do, and it is friendly on our gums. It's also best to brush in the morning when you wake up because brushing in the morning also removes the bacteria that is built up in your mouth overnight. And obviously at night before going to bed to remove the food debris so that bacteria will not thrive on it and weaken the enamel. Moreover, as what Ashley have discussed a while ago, we should not also forget to clean our tongue because biofilm could also accumulate there and cause bad breath. So here we just use the tongue cleaner. And if you have a tongue cleaner that is included on your toothbrush, you can also use that one. All right, so I'm done discussing how to clean out the outside and the inside areas of your teeth. Now I'm going to discuss how to properly clean in between, which you guys probably know because I have already introduced it earlier, and that is flossing. So we should not forget to floss as well because when you skip flossing, you fail to clean up to 35% of your tooth surface area. So here are the sequence on how to properly floss your teeth, and I also included a video for you guys to see after this. So first is to grab a floss that is 18 inches long or an arm long. So, and then wrap it on both of your middle finger. So what I would like to do is to wrap a few on the other middle finger, and then that's gonna be my dirty side, and wrap the remaining on my other finger, and that will be my clean side. Here, I also included some hand gestures that you can use when you floss. So A is for upper teeth insertion, where you can use your pointy finger and thumb. And B is where you can use both of your thumb. And C is for lower insertion, where you can use both of your pointy finger. However, this are just some recommendation, and it's still up to you on how you want to floss your teeth. And then what you would do is to work the floss between the teeth in a short seesaw motion. So the seesaw motion helps us not to snap the floss so you won't cut your gums. And then next is to curve the floss around the tooth in a C shape. Then press the floss firmly against the teeth on both sides, and then move gently beneath the gums. And don't be afraid if you go beneath because this is where we also want to clean. And then gently slide the floss up and down. And it is also best to begin flossing on the very back teeth, going around so that you have a sequence and you won't miss any teeth. But still, it depends on your preference. These are just some recommendations. All right, so here's a video on how to floss your teeth. All right, so first grab a floss that is 18 inches long or an arm long, and then roll the floss on both of your middle finger. So roll a few on the side, that would be your dirty side, and roll the remaining on the other side, and that would be your clean side. And here are the steps. All right, so work the floss between the teeth in a seesaw motion. So this seesaw motion, once again, will help us not to snap the floss in our gums, so we will not cut it. And the next thing you do is to C-shape the floss. So really curve the floss, forming a C shape on both sides of the teeth. And then gently work the floss up and down. So as what you can see here in the video, it is effectively removing that biofilm in between teeth and at the gum line. And then roll the dirty side of the floss into the fresh side. And also make sure that you floss every teeth and have a sequence so you won't miss any. All right. So here are some helpful tips for you. So it is best to floss every after you eat so that the food debris will not stay in your mouth and makes it a good environment for the bacteria to grow. It is also best to floss before brushing because the fluoride on our toothpaste will get into our teeth as well. And flossing before going to bed because again, the food debris that was left in your mouth will be removed and will not grow. All right, thank you for listening to my topic. And now moving on to our discussion. Fatimah?
Thank you, Janine. So now in summary, 4 points of our to make the healthy mouth. First is, sorry, let me move my screen here so I can. So have a regular visit to the dentist's office, as Ashley recommended and said, twice a year, that's ideal to check our gum and total health, oral health. So preventing oral diseases such as gingivitis, periodontitis, and caries, the most common, which is cavities known as. Also, gingivitis is the red inflamed gingiva, and the periodontitis where you lose the bone. So now, Janine, you want to discuss the last two?
All right, so also guys, be mindful of what you eat. So what we learned today that cryogenic food is bad because they lower the pH level in our mouth and weakens the enamel. And we need more non-cryogenic food in our diet because they keep our mouth healthy as well as our body. And if you really can avoid snacking, try to eat them in one sitting rather than snacking all throughout the day. Or you can just simply replace those snacks into a non-cryogenic one, which is the healthy food. And also do not forget to brush and floss your teeth at least twice a day and in 2 minutes. So using the BAS method and C-shaping is good for you. All right, done. Now, are there any questions or clarifications that you want to ask before we move on to our Kahoot game? Are there any questions? No? If none, all right. So Ashley will take over for our Kahoot game. Ashley?
Okay, so if you guys can grab a device and just enter the Kahoot website, as well as the code that I will provide. If you don't have a device, that's okay. Okay, I will share my screen now. Janine, can you let me share my screen? Thank you. Okay. So this is the code for the Kahoot game. All right. Is that everyone? Okay, so I'll start. Oh wait, Kayla? Okay, so I'm gonna start now, if that's all right with everyone. So this is just a review on what we presented and what makes a healthy mouth. So the first question is, how often should you visit your dentist or dental office? So there's once a year, never, every 6 months, or only if I need a cleaning. That's good. So everyone got that correct. So it's every 6 months. That is recommended by the Canadian Dental Association. Okay, the next question is, which dental team member assists the dentist in certain procedures and provides patient care? So there's the dental receptionist, dental hygienist, patient helps, or certified dental assistant. Yay, everyone got that correct. So good job. Okay. Between gingivitis and periodontitis, which gum disease is more severe? Okay, so periodontitis is the gum disease that is more severe because it affects our bone levels, whereas gingivitis, it only affects our gums. It makes our gums really red and inflamed. What is the best way to remove biofilm? Correct. Brushing and flossing is the best way to remove biofilm. All right, so the last question is, which snack would be best for your teeth? Okay, everyone got that correct. So good job. So that is the end of our Kahoot game. So I will let Janine. Okay, second, John. First place is. Yay, good job, Ying. Okay, so I'll let Janine present our slides now. So I will stop share.
All right, congratulations, Ying. Good job. And thank you everyone for participating to that Kahoot game. And for the winners, so, okay, so before we end this presentation, we would like to ask you some couple of questions and you can just unmute yourself to answer. All right, so first is, what part of the topic did you find interesting?
Sorry, Janine, do you want to share the slides again?
Oh, sorry, I thought I already shared it. Sorry about that. All right, here you go. Much better. All right, so sorry, which part of the topic did you find interesting? Who wants to answer? Okay, Ying?
I didn't really know that there was brushing techniques. I thought you just kind of
Yes, go over there and just do like that. Yeah,
Yeah.
so yeah, the best way is bus method. So if you could do that on a daily basis, that would be great for your oral health.
okay.
All right. Does anyone want to share as well, or we're moving on to our second topic? I mean, second question. Okay, so the second question is, what are the tips that you find helpful? So anyone can unmute yourself and try to answer.
I thought that it was a cool tip for unavoidable situations wherein you can, or wherein you eat those like unhealthy foods, you can always just rinse with water after.
Yes, yes. So yeah, when you eat those sticky foods, or if you drink acidic drinks like Coke or sugary drinks, so yeah, it's a good way to rinse your mouth as well, so that they won't stay in your teeth. But it is very also good to brush and floss. All right, thank you so much, Kayla, for. All right. Does anyone wants to share, or we're all good? All right. All right. So that is.
Sorry, Janine, just to clarify on the last bit. You don't want to brush after your acid, like the acid level in your mouth is increased, because that will weaken your enamel even more. So it's better, if you want to eat sugary stuff, it's better to brush before you eat the sugary stuff, so there is no biofilm that this bacteria will stick on and produce more and multiplies more and produce that acid level more. So just to clarify here.
Okay, sorry about that, guys. Yes, thank you so much, Fatimah, for clarifying that. All right, so that is all for today, guys. So on behalf of the CDA program at PCC, we thank you very much for listening and coming to our Zoom meeting today. We really appreciate your presence. And remember, guys, a healthy mouth is equivalent to a healthy body. Thank you, everyone.
Thank you,
Thank you for the
guys.
presentation. Good job, everybody.
Oh, thank you
Good
so
job,
much, Ying.
everybody.
Thank you.
Thank you so much.
Thank you guys for joining.
Okay.
So much.
Okay, goodbye.
Bye, guys.
Thank you.
Bye.
Thank you.
Thank you.